If you think heart attacks always come with chest pain and clutching your arm, think again. For women, the signs can be much more subtle and often ignored until it's too late. That's why understanding female heart attack symptoms could literally save your life. Did you know that heart disease is the #1 killer of women over 50? And yet, most women don't realize that their symptoms can look very different from what you see in movies or hear about in men. They may feel more like fatigue, nausea, indigestion, or even back pain. Sometimes, these symptoms are dismissed as stress or aging, but they could be serious warning signs of a heart attack. In this video, you'll learn the key female heart attack symptoms you should never ignore. We'll explain what's happening inside your body, how women's hearts respond differently, and why those quiet signs deserve your full attention. Most importantly, we'll share simple, science-backed ways to prevent heart trouble before it starts. If you've ever searched for female heart attack symptoms, this is the video you need. Stay with us, because the next few minutes could help you or someone you love live longer and stronger. 1. Why heart attacks can be different in women. Heart attacks don't always follow the same rules for men and women. In fact, many of the warning signs that doctors and public campaigns focus on are based on male symptoms. But women often experience different patterns, and those differences matter. A major reason is biology. Women's hearts and blood vessels are structurally smaller, and hormonal changes, especially after menopause, can affect how blood flows and how symptoms appear. While men are more likely to have a complete blockage in a coronary artery, women are more prone to microvascular disease. That means smaller arteries in the heart become damaged or narrowed, leading to more subtle, less dramatic symptoms. Stress also plays a different role. Emotional and mental stress has been shown to trigger heart events in women more than men, sometimes without any physical blockage at all. This is why some women report feeling extreme fatigue, tightness in the jaw or neck, or a sense of unease before a heart attack, not the crushing chest pain that many expect. Unfortunately, these symptoms are easy to dismiss. Many women chalk it up to stress, indigestion, or just getting older. But ignoring these signs can delay life-saving treatment. Recognizing that female heart attack symptoms can be different is the first step. Understanding your unique risk factors, like family history, high blood pressure, diabetes, or smoking, can also help you stay alert. The more informed you are, the faster you can act when something feels off. Next, we'll break down the most common and the most surprising female heart attack symptoms you should never ignore. 2. Common versus subtle female heart attack symptoms. When most people think of a heart attack, they picture sudden chest pain and a dramatic collapse. And yes, that can happen. But for many women, the signs are far less obvious, and that's what makes them dangerous. Let's break down which symptoms are most common and which ones are so subtle they're often missed. Yes, chest pain or discomfort is still the #1 symptom in women, but it doesn't always feel like a sharp stab. It can be more like pressure, tightness, or a heavy weight on your chest. It may come and go or feel more like burning or squeezing. Some women don't even call it pain. They describe it as discomfort or fullness. But here's where things start to look different. Women are more likely than men to experience other symptoms that aren't usually linked to the heart. These include shortness of breath, especially without exertion, nausea or vomiting, and pain in areas like the back, neck, jaw, or even the shoulder. You might also feel lightheaded, extremely tired, or break out in a cold sweat. Symptoms easy to dismiss as anxiety or overwork. One of the most overlooked signs: unusual fatigue. We're not talking about just feeling a little tired. We mean exhaustion that hits out of nowhere, even when you haven't done anything strenuous. Some women report struggling to walk across a room or suddenly needing to lie down. This kind of fatigue can show up days or even weeks before the actual heart event. The problem is these symptoms don't scream heart attack, they whisper. And if you're not listening closely, you might wait too long to get help. Understanding how these symptoms can present together or in isolation is critical. You may have only one or two signs, and they may not even feel severe. But if something feels off, especially if you have risk factors like high blood pressure, diabetes, or a family history of heart disease, don't wait. Coming up next, we'll talk about exactly which symptoms you should never ignore and when it's time to seek medical attention immediately. 3. What you should never ignore. There are moments when listening to your body can make all the difference. When it comes to heart health, that moment is now. If you experience certain symptoms, no matter how mild, they should never be brushed aside. So what exactly should you never ignore? First and foremost, persistent chest discomfort. Whether it feels like pressure, heaviness, tightness, or a burning sensation, if it lasts more than a few minutes or comes and goes, it's time to act. This is especially true if the feeling spreads to your arm, back, jaw, or neck. Next, shortness of breath that isn't explained by physical activity is a major red flag. If you find yourself winded doing everyday tasks, like walking across the room or climbing stairs, pay attention. This could be your heart struggling to pump blood efficiently. Sudden extreme fatigue is another serious sign. We're not talking about regular tiredness at the end of a busy day. This is the kind of fatigue that feels like your body is running on empty for no clear reason. If it's new, intense, or unusual, don't write it off. Also, never ignore nausea, cold sweats, dizziness, or a sense of doom, especially if they appear together. These can be signs of a heart attack, even without chest pain. The key is to trust your instincts. Women often second-guess themselves, worrying about overreacting. But when it comes to female heart attack symptoms, it's better to be safe than sorry. Call emergency services, go to the hospital, and let professionals rule it out. In the next part, we'll show you how to lower your risk and prevent these symptoms before they start. 4. How to prevent female heart attack symptoms. The best way to beat a heart attack is to prevent it in the first place. And the good news is, you have more power than you might think. By making a few changes to your daily habits, you can significantly lower your risk of ever facing those frightening symptoms. Let's start with the most important step. Know your numbers. Blood pressure, cholesterol, blood sugar. These aren't just numbers on a chart. They are critical indicators of your heart's health. Get regular checkups, track your stats, and talk to your doctor about your personal risk. Next, take a look at your plate. A heart-healthy diet is one of the most effective tools for prevention. That means plenty of vegetables, whole grains, berries, beans, and healthy fats like olive oil or avocado. Cut back on processed foods, added sugars, and salt. And yes, you can still enjoy your meals, just with smarter choices. Exercise doesn't have to mean hitting the gym for hours. Even a brisk walk for 30 minutes a day can strengthen your heart, improve circulation, and reduce stress. The key is consistency. Move your body regularly and choose activities you actually enjoy so you'll stick with them. Speaking of stress, don't underestimate its power. Chronic stress increases inflammation and blood pressure, both of which can harm your heart. Build in time to relax, whether that's through meditation, deep breathing, stretching, or just sitting quietly with a cup of tea. Your heart needs peace as much as it needs movement. Sleep also plays a role. Poor sleep can raise your risk for heart problems, especially if it's tied to conditions like sleep apnea or chronic insomnia. Aim for 7 to 8 hours of quality rest each night. If you snore loudly or feel tired even after sleeping, talk to your doctor. If you smoke, now is the time to stop. Smoking is one of the most dangerous risk factors for heart disease, especially in women. The sooner you quit, the sooner your heart starts healing. And lastly, stay informed. Knowing what female heart attack symptoms look like and how they differ from men can save lives. Talk to your family, your friends, and your doctor. The more we normalize these conversations, the more prepared we all become. In the final section, we'll bring everything together with a powerful reminder and a clear plan for what to do next. Now you know the truth about female heart attack symptoms and how they're often misunderstood, overlooked, or mistaken for something else. But awareness is powerful. Recognizing the signs, knowing your risk, and taking small steps every day can truly protect your heart. If there's one message to take away from this video, it's this. Don't ignore what your body is telling you. Whether it's a strange fatigue, shortness of breath, or pain that doesn't feel quite right, listen to it. Getting help quickly could save your life or the life of someone you love. Heart disease doesn't have to catch you off guard. With the right habits and the right knowledge, you can stay strong, stay informed, and take charge of your health. And if this video helped you understand female heart attack symptoms more clearly, consider sharing it with your friends, sisters, mothers, and daughters. Conversations like these matter more than we realize. At ActiveHealthCare, we're committed to helping you live smarter and stronger every day. So be sure to like this video, subscribe to our channel, and hit the notification bell. There's more life-saving health content coming your way, and we want you to be part of it. Take care of your heart, take care of yourself, and we'll see you in the next video.